So I am a medical doctor. I worked for many years at the interface of medicine and social problems. So I also did social anthropology as part of my first degree. So everything I do in my work is really thinking about how the environment affects the individual, and in particular the mental health and well-being. What I do is focus on adolescent mental health and well-being. I'm very interested in the young people who might need help from mental health services, for example, but never able to access it. Why does, for example, a child from a refugee background, an area that I've worked with for over 20 years, why these children might not want to come and speak to mental health professionals, even when they feel they need it. So everything in my work right now is trying to understand how we can make services better, more accessible, more helpful for the kids that might need it the most. 2 or 3 months of complexity in a child's life might impact on their ability to sit exams, might impact on their decision of what type of career they're going to do in the future. It might actually impact on a whole range of their life choices. So this isn't something you can just sit around and wait on. These are actual real lives, really important. And so what we need is a robust way to look at it, but also try and be responsive and working in the here and now. I conduct a survey called the Oxford Student Survey. In 2023, we had 43,000 students from over 200 schools participate from across England. The schools use a school lesson to invite the students in that class all to participate. So what we get is as many voices as possible answering our questions. And this isn't a simple, short survey. This is a survey of over 200 questions. And what we get then is an incredibly rich source of information actually about what young people want. And what we've done in the survey is really ask, like, have you ever accessed services? How did you find them if you did? If you didn't, what would have helped you access them? Why didn't you access them? So for example, we looked at a group of students who had self-harmed within the last month. Well over 1,000 of these students. And we could look at exactly what they did after self-harm. So 40% of them, so 4 out of 10 said that they went to nobody. And the majority of those did not find it helpful. So we immediately have a group of young people who are self-identifying as needing support but unable to find it or know where to go or access it. Then of those that did seek support, the majority go to their friends, which is entirely normal for adolescents. It's what we would expect. But actually many of them don't find their friends helpful either. So we can start to think now more about what to do in the school environment to understand and let friends know about, what it is that they can do to help. Another finding that I think is really interesting is that less than 10% went online or to text-based resources. So we know if we've got resources to allocate and we're worried about certain groups of kids, through big data sets like the Oxford Student Survey, we can actually find out more about, for example, those of different ethnicities, those who might self-identify as neurodiverse or neurodivergent, which service type is better, and we can start to do much more to tailor what we do to those most in need. Oxford is an incredible university in which to work. There are experts across the board in almost every area that is important for my research, for example. So we're now really looking at the practical implications of our research. What can we do? What can we change in the school environment? So we, for example, in the Oxford Student Survey, looking at bullying data, because bullying is one of the strongest predictors of later mental health problems throughout the life course. And so what does that mean in a school? Well, we have at the Department of Education here at the University of Oxford. We also have colleagues in the Department of Experimental Psychology specifically interested in bullying. So together with kind of our findings, the psychiatric concerns of this population, working in schools, working with departments of education, departments of social policy, departments of psychology, we're actually really able to think together about what can we do to change. What we all want to do is bring about impact as soon as possible for young people currently at school. If you're a young researcher in the field, my biggest bit of advice is we need you. So come work in this area. There's so much need and there really aren't enough people looking into it. I'm almost embarrassed that given that almost everybody on this planet goes to school, we still know so little about the best ways to support young people in their mental health in the school environment. We have a little bit of understanding of what we call high-income nations. We have absolutely none in the lower and middle-income nations of the world, and yet the vast majority of young people on this planet are living in low and middle income countries. But schools are absolutely everywhere, so we desperately need more brains, more people, as well as more funding in order to start to look at this in a much more meaningful and much more robust way. If I had a blank check, what I would be doing is thinking about the importance of making the research and the school environment much closer. Schools go, oh gosh, this is a problem with bullying for this group. Let's try this intervention, which has been shown to work, for example, in New Zealand. Let's try it in England. Let's collect the data. If that's helpful, we can then quickly share those findings across as many schools as possible. So what we need is a way to collect really good data that is scientifically robust, so that as soon as it's collected, then schools can go, right, we should do this because we're convinced of the data. And we as researchers are also convinced that that's the right finding. So I'm very interested in building what we're calling a mental health platform that schools can work with us as partners.